setting up Welcome to the April 1st COVID-19 update from the city of Burlington. I'm Mayor Weinberger. We have a number of guests joining us today to talk about various aspects of this emergency and the city's response to it and the response of our partners. First, we're going to start one of our key partners, probably maybe the most important institution in the state in the fight against this virus is the UVM Medical Center, and the president and chief operating officer of the medical center has been leading the hospital's response and preparations and to this epidemic, as well as many other community health initiatives in recent years. We're fortunate to be joined again by Dr. Stephen Leffler. Dr. Leffler, thank you for taking time out of what I know are incredibly busy preparations up on the Hill, and more than preparations, you guys are actively caring for many members of our community at this point. What can you share with us about how the fight is going?
Thanks, Mayor Weinberger. So at the medical center today, we have a total of 18 COVID positive patients in the hospital, mixed between our intensive care unit and 2 of our floors. We're still slowly expanding our floors to care for more COVID patients, and we have about 10 more patients who are ruling out. So we're pretty much staying about the same. We've had between 15 and 20 COVID patients over the last couple of days. I'm happy to tell you we are able to discharge a couple of COVID patients home. That's a great thing. So we do have people that are recovering and are going to be able to leave the hospital. And there's been a tremendous amount of change at the hospital. It really looks quite different than my usual time here in terms of we have really strict policies now on when people come in the building. We're measuring temperatures. We're asking about symptoms. We changed our visitor policy to really be strict but compassionate in the right situations. And we've really changed a lot of work around our elective procedures, elective surgeries, screening exams, really so we can do our part for social distancing and to conserve our PPE supplies. Like everyone else in the state, we've been spending a lot of time looking at the predictive models. The number one question I'm getting is, when do you think the surge is going to be? And I will tell you, it's a little tricky. It looks and feels to us right now like all the social distancing, great work that's happened in Burlington and Chittenden County in the state of Vermont could be having a positive impact. And so we feel like right now we have a pretty good handle on things, and the market increase in inpatients hasn't happened yet. So we may actually be blunting the curve a little bit. And what that means to me is we got to keep doing it. It's not the time to relax anything. I think that this sacrifice that our communities and everyone's making to keep people out of the hospital feels right now like it's really potentially making a difference in Vermont. That doesn't mean we still won't have a surge. That doesn't mean we still might not have patients getting care in places that they wouldn't normally. But it does feel like right now that we have good capacity to care for patients. You should know that in the hospital today, we were about half full compared to normal day in April. And that other half of that capacity is basically ready for COVID patients who are sick. We've increased our intensive care unit capacity significantly. I was just touring that before I came over here. And we really done a lot of work to make sure that we have enough ventilators and support to care for people who will need us. So lots of good work going on there. But the last 2 days, I've seen some data that shows that all of the hard work that Vermonters are doing to keep each other safe, maybe working way too early to say victory, but encouraging in this difficult time.
Excellent.
I want everyone on this call to know how much work we've done with the state of Vermont, the Department of Health, the Emergency Operations Center, and the National Guard to build additional capacity for Chittenden County and for the state. People who have been on the UVM campus know that we've stood up a large facility outside of Converse Hall to care for people with respiratory complaints who can be managed outside of the hospital, outside of the ER. You'll still get great care out there, but that keeps people out of the ER. So that's a great collaboration between the National Guard and the UVM Medical Center. We're in the midst of getting ready to open a large facility at Patrick Gym that could care for 150 to 200 patients. That's really being run by the EOC of the state of Vermont, but UVM Medical Center is proud to be staffing that. Really good work and plans are going in there. And also I met with the National Guard today, and they're standing up another 400 beds over the Champlain Valley Fairground. So I think our capacity is as good as it could be. And really, everyone in the state has come together to offer what they have available in terms of equipment, people, support, logistics, space. Really great work there. And I'm proud that we're using the time that we have. I mean, we know what's going on in New York City. So to see us do everything that we can to be prepared if that does happen here is encouraging. In terms of our PPE supplies, we're in reasonably good shape right now. There are some things that are starting to arrive, and we're getting some things from new sources. So we're still being very, very cautious with our supplies, and we're counting every one, and we're meeting every single day on that. But we're in good shape right now. We have adequate supplies to keep our people safe. We have taken some conservation measures with our staff so that we are assured not to run out, but we're in reasonable shape. We, of course, like to get more, but we're good there. People are asking a lot about ventilators. We have, at normal times, 70 plus ventilators. We have access to more than 100 right now. We have spaces to ventilate 100 people if it came to that. And so, and right now we're not using a lot of ventilators for the COVID patients. We're using some, but not that many. So we have a lot of capacity there if we need more. And I'm getting a lot of questions, about how is our staff doing? Our staff is actually amazing. They're exceptional. They are dealing with all the change in the past 3 weeks. Everything that they do here, for many of them, looks quite different. They're working on different floors. They're learning new protocols. They're coming to work and showing up in different ways. We've changed pretty much everything that happens around here, but they've been adaptable, flexible. They're courageous, and they're handling this with kindness towards each other and patience and grace. So, they're nervous like all of us, but I think we should be proud of our medical colleagues and our EMS squads and everyone that's rallying for this, because people are doing amazing things. Great. So that was most of my update. I'm actually happy to stop there. And Moreau, if you had a question or something, I think we have a minute or two.
Well, Dr. Leffler, thanks for calling in. That I am encouraged by that report, and it is, last couple of days at these updates, I've been voicing some cautious optimism from what we're hearing out on the West Coast in Seattle. They definitely have some evidence that they have bent the curve there. Yesterday, we talked a little bit about this KINSA health map, where they have 1 million thermometers around the country and are getting a sense that whereas we did have spiking temperatures and populations last week, countrywide, that is starting to go down. And now we're hearing it straight from you on the front lines here in Chittenden County that there is reason for optimism that the social distancing is working. And I appreciate I'm encouraged and hopeful to hear that you see it that way too. I also appreciate how you said it, that what is important about this message is not a declaration of victory by any means. We are going to be battling this virus in a variety of ways, I think, for many months to come. But I think it is encouraging. It should be reaffirming to people. And people, we've been asking Vermonters to make such sacrifice. We've been asking everyone to turn their lives inside out, take care of their kids at home, stop going to work, don't see friends, don't socialize, be careful when you're out of the home that you don't get in within 6 feet of each other. I think the evidence is building that people are doing it. It is working, and I hope what everyone takes from that is that we need to keep doing this. That this is a successful strategy. As you said when you were with us last week, we don't have a vaccine. We're not going to have a vaccine for a long time. Social distancing is what we have to protect ourselves from the virus until we have a vaccine. There are some other strategies we'll start to talk about, I think, more in the weeks ahead, is hopefully we move towards lifting the stay-at-home posture and can be ready to battle the virus as we reopen society in a new way. But for now, the strategy of social distancing is critical. There's hopeful signs it's working. We got to keep at it.
I mean, I'll just say one more time that right now, everyone who's doing their part in social distancing is literally saving people's lives. So you doing your part to stay home and really try as hard as you can to avoid other people right now, you're a hero too. I know it's hard for us, but it is making a huge difference. So like I said, it's not time to declare victory. It's time to double down and keep going until we know we're in good shape.
Great. Well, thank you for that, Dr. Loeffler. We'll let you get back to it. Thank you for all your service and your whole team. Everything that I know the people on your team are making it's generous of you to say it the way you did. Things being harder for you and your team are like people not going home to their families for days after day because they don't want to expose their family members to risk. People working incredibly long hours. We are appreciative for all of the effort. We're appreciative to have the institution here in our city. Thank you for what you're doing to keep us all safe.
Thank you, Moreau. Thanks, everyone.
I do want to just say a word more. We don't have the chief here today. I do want to say again, consistent with what we were just saying, from our observations out there, the great majority of Burlingtonians and Vermonters are working really hard to make good on the governor's order, to make good on the orders that the city has in place, to really do what they can to bend the curve and slow the spread of the virus. We do see a small minority of people who are either intentionally or not intentionally have not gotten the message yet, and who are putting others at risk in congregations and public areas with rec equipment. I do just need to repeat what has been said in the past, that we need everyone to understand this message, hear it, and do their part. The city is considering taking further enforcement actions in the days ahead, given that we are seeing some concerning failures to comply with the governor's order. We hope that is not necessary, but I do want people to know we are planning for the next steps, given that we have seen in the parks some concerning activity. Let's turn to a new topic now. We want to talk today about masks and a hopeful community mask initiative that is underway, and I think has real promise for being an important strategy in the battle against the virus in the weeks ahead. If you've been paying any attention to the news, you know that these masks are a key resource in healthcare settings, in hospitals, in nursing homes that serve the elderly, and we have seen headlines like this one from the New York Times today. There's a global battle, a global free-for-all. They're talking about going on to find masks for healthcare workers, for medical workers. We just heard from Dr. Loeffler, fortunately, because of proactive planning at the UVM Medical Center, that is not the case currently locally. We just heard from Dr. Loeffler that the medical center is in pretty good shape with respect to their masks, the supply of their masks, and that is generally what we hear from other institutions in town as well. But we weren't so sure about that a few weeks back, and we started in conversations with the medical center and others because, and I'm joined here today by Brian Lowe, our Chief Innovation Officer. An observation that that we agree on is that local actions matter in pandemics. That's our lessons from history. So we started over a week ago looking into what we could do if it was necessary to help with the mask supply for initially the conversation was around, is this going to be needed to support our medical workers? The conversations have shifted because we're feeling pretty strong and good about where our medical providers are, to a kind of a big new idea, which is that we try to go beyond the provision of masks to healthcare workers and explore whether it would be possible for us to mask all of our essential workers here in Burlington. Why would we do this? Well, masks are a very effective tool in stopping the spread of the virus. They are protective for the individual that is wearing the mask, because they, through a number of mechanisms, reduce the chances of the virus getting into the nose or mouth of the person wearing it. They also are protective to everybody else. When someone who is wearing a mask is infected and is at risk of spreading the virus, the mask helps contain those germs and keep them from going out into the public. And given the characteristics of this particular virus and the illness that comes with this, that second component is very important, because we know that a CDC study this week said that maybe 1 in 4 people who has the virus is not symptomatic at all, and therefore wouldn't know, especially with our current state of very insufficient, ineffective, not nearly enough testing taking place. We expect there are a large number of people walking around who have the virus, are spreading it, and don't know it. The mask can be an effective deterrent for that. That 25% figure, I guess I want to point out, may be low. There have been other studies that have suggested that maybe it's as many as 50% of the people are asymptomatic. So the city, working with a number of key partners, is looking at what it would take to put masks on all essential workers here in Burlington. And first thing we want to do in that, well, it's not the first thing, but an important step in that, if we could advance the next bullet here, if you are an essential worker, or you are an organization that is employing essential workers here in Burlington, we want you to get in touch with us. We want you to let us know over the next 48 hours if you are interested in getting a mask. And we also are interested, if you have skills that could help us make these masks, we also would welcome you reaching out to us. We're already in touch with several partners that bring that kind of skill, but we may have a need for more. And here's what we're going to do with this information. And that the last slide, hopefully you saw, was a phone number, and there's also an email there. Either one of those, getting in touch with us, telling us that you're interested in either helping make these masks because you have sewing skills and equipment, or you are interested in receiving these masks as an essential worker, let us know through one of those 2 channels. Here's what we're going to do. We have procured over the last week 1,400 yards of bold denim, which is a thick fabric. And I think we have a picture of the truck that brought it into town there. So you can see it's an extensive supply. And we have, working with the Lyric Theater Company, and I think this is kind of a great story. The Lyric Theater Company, of course, people know for putting on wonderful musicals every year at the Flynn Theater using local talent. Well, now they're using local talent in a new way. They are repurposing all of the volunteers that they have in the community that help make costumes. They have put specs for a new bold denim fabric mask out to their skilled troupe. And we are also working with the Milton Artists Guild. And we have, working together, created these prototypes of 120 test masks that we uses that material and that skill, and we are just starting to fine tune them and test them. I'll try putting it on in a second, but here's what the masks look like. We understand from experts, this happened quickly, but there's been a lot of thought and planning that's gone into this. And our Chief Innovation Officer, Brian Lowe, can speak to it more in a second. We understand that this bull denim fabric will likely make these masks more effective than other homemade masks. That has been a real concern about some of these other efforts out there using lighter weight cotton materials that there's concern, they may be better than nothing, but they may not do good enough job to really put a lot of stock in it. And we are also in the process of testing these with a medical institution. And Brian, why don't I turn it over to you here and let you speak further to the specs and how we're working with others to try to confirm that these masks do what we hope they'll do.
Sure, I'm happy to speak a little bit to that, Mayor. Thank you very much for the chance to speak to this. And I know Councilor Joan Shannon is on as well and can speak to some of this as well. But we working with representatives from the Leahy Clinic in Boston, which is a level 1 trauma center in Massachusetts, and talking with UVMC, elected on this particular mask design. We're hoping that these masks work up to a surgical mask level. These are not N95 equivalent masks. They would not offer that kind of protection. All different masks have varying strengths and weaknesses. This is a surgical grade mask that would have some, we believe, ability to help slow the spread of transmission of the virus. It is not an N95 level equivalent. And as the mayor said, we're looking to consider doing this for essential workers in the city. And the reason for doing this is that if you have masks that have some value in slowing the transmission rate of the disease, particularly when you combine it with good hand hygiene, good hand washing, and you know that there's a significant population that is asymptomatic and also positive for the virus, and you know that the CDC guidelines are clear that if you're sick, you should wear them, it makes sense to try and expand the pool of masks available for people doing essential work in and around our community. There.
Great. I want to go to South District City Councilor Joan Shannon, who has been working as a liaison in this effort, trying to link up different resources here and make this effort possible. Joan has been a real leader within the community on COVID-19 response issues. She has been frequently in touch with me throughout this, making sure my attention and the other city leadership attention was focused on the right things throughout this epidemic. Welcome, Joan. Thanks for joining us this afternoon. I think your audio, Joan, we're not hearing you.
I think, Joan, we're having some difficulty hearing you.
Maybe what we can do, Joan, if you can call in, maybe we can get your audio that way.
That's a good idea. So leave your video on, Joan, and call in to the meeting. You'll want to turn the sound off on your computer so there's not a bad echo.
All right, we can see that Councilor Shannon has her phone up and she's attempting to call.
And maybe what we can do, Mayor, you can keep moving forward. I know we have a little more to talk about with this mask initiative while we get Councilor Shannon on the line.
Okay, great. If you guys keep working on that, it would be great to hear from Joan. There on the photo on the screen, you can see the executive director of the Lyric Theater, Erin Everts, modeling a mask. One want to just speak a little bit further about this effort and the kind of broader implications. I mean, first of all, I want to be clear that to the degree people have N95 type masks, those masks, it's really important that we continue to take masks of that quality and ensure that they are headed towards healthcare workers. The point of this effort would be initially, again, whether we could create locally other masks that would help preserve the health of all essential workers. This could be a strategy that is important for some time. We know that we are facing weeks, maybe months ahead of having real risk of community transmission of the virus, not having a vaccine in place, not having effective treatment. As we try to turn back on, get through this period and then move towards a period where more of the economy is functioning again, these masks could have a key role. And then down the road, we are looking at whether there are even broader strategies that masking could play a role in as we start to emerge from the stay-home order. We're thinking about that. We've got the analytics team that we talked about yesterday looking at that, and we expect we'll have more to say after more consultation with state officials, looking at federal guidance. The federal guidance up until now has been somewhat conservative about recommending masks outside of medical settings, but you get the sense that that is starting to shift in recent days. Do you want to speak to that, Brian?
Currently, for healthcare personnel, the CDC does recommend in extreme situations that you should use some kind of face mask protection, including up to a bandana. I think the thing that I want to make sure I'm conveying here is that these masks that we're thinking about trying to produce here, they reduce the probability of transmission, we believe, but it's not like wearing a mask keeps everybody safe. I don't want to overstate or have people come away from this feeling like a mask would keep you safe. It's just another method for us as a community to step in and help reduce that likelihood of transmission and help reduce and flatten the curve that the healthcare community has to deal with.
Joan, we can hear you now, so maybe we should.
Okay.
Go ahead, Joan.
Thanks for your patience. Sorry about that. Thank you, Mayor. So I just want to say the city team has been amazing, from Brian Lowe to Jean Richards and Aaron Desautel's over at the airport and their whole team there. It's just been a real team of problem solvers, including Lyric Theater and the Milton Artists Guild as well. The masks are not the easiest thing to sew because this fabric is thick, and these sewers have worked out their own teams as well, where if somebody's machine doesn't have the strength to go through the fabric, they're working on certain pieces of it and then passing it along to somebody who has a stronger machine who can do the other parts of this work. So we really appreciate that spirit coming from the community on this project as well. And as you noted, we've got 120 out there testing. Actually, the first 60 went out this morning. And so we're waiting to hear feedback on those, but we're still continuing to produce them. And if we need, in this situation, we kind of do everything and modify as we go and as needed. And that's very much been the spirit of everybody working on this project.
Thank you, Joan. Go ahead, Brian. Yeah.
Thank you.
I think, Joan has done a lot to help us solve these problems, given her background and her kind of unique career experience. And I want to make sure we recognize that here. I also want to say, just as we're putting out this call to get a sense of what the demand is from essential workers, people should understand that we are scaling this production. It's not like we have these masks ready to go today. We're testing them, making sure they work well, and then would scale following that.
When we have a better sense of the need, the total numbers that we're talking about in terms of essential workers, and we've gone through this first round of working with the prototypes, I'm hoping, my request of the analytics team is that by the beginning of next week, we could be in position to update the public and announce some kind of production goal for when we could be in position that the city could say anyone who is an essential worker who wants one of these washable, reusable Bull Durham masks, we're going to get it to you, and we're going to get it to you by a certain date. We're not just to say that today. You're getting in touch with us will help us get there in the days ahead, and we'll be back in touch with more on that soon. Let's thank you again, Joan. Couple other things to touch on, and then we will open this up for questions. We've been talking every day about the work going on at the Resource and Recovery Center. This is this center that was created Monday of last week in response to this emergency. It is being staffed by Community and Economic Development Office staffers, as well as individuals from the Burlington Electric Department who are have a customer service background. And one of the services we're trying to provide out of that Resource Recovery Center is translated materials for the numerous different New American communities that live here in Burlington. We want to make sure that everyone is getting the life-saving messages about the virus and can understand them. We're putting up here on the screen an example of one of the messages that is going out. People are going to see more signage and materials like this around town in the days ahead. We are going to try to use the flag and this consistent imaging, if you will, to make it clear this is communications that is coming from the city and that it can be trusted. There will be banners, 10 banners going up as soon as we can get them up that have information like what we're showing you here, as well as contact numbers, so that we've been putting out this call every day here in these briefings and online and various digital platforms and through the traditional media to get in touch with the Resource and Recovery Center, and we're getting a big response to that. I think the last report, I think we had 50 calls just yesterday. But as we get deeper into this, we know the need's going to grow, and we want to make sure that there are no barriers to getting in touch. If you need help, we want to get that message out in 13 different languages. We want to get that message out through every platform we can, so that Burlingtonians who need help in the days and months ahead know how to get it. I want to particularly thank the partners of the Burlington School District, the City of Winooski, Vermont Department of Health, Spectrum, the UVM Medical Center again, and the U.S. Committee on Refugees and Immigrants for their partnership with the city in creating these PSAs and getting them translated. And I want to thank the Resource and Recovery team. Do we have Pitt on this call? So
I
great.
think we do. Yes.
Great. Pitt, thank you for your work for the community and for ensuring the city has good communications with the various New American communities that call Burlington home. That has been one of your key responsibilities for years. This is a particularly important time for those communications. How's it going? What else would you like to share about this effort?
This is definitely a much needed effort. I'm really happy to be a part of this team and have be part of the resource recovery team and working in this area. We definitely want to do our best to reach the full public, and beyond just getting information out in English, looking at translating and also hiring interpreters so that we are serving the full public. So yes, everything that you've said with our partners have been great in developing a multilingual Vermont task force to really learn from the agencies themselves has been a great understanding for the cities, so that we could take it back and create a messaging that's much more culturally relevant. And also in looking at our outreach, so that we are looking at ways to get this out there beyond just social media, developing ways that we are reaching people via telephone or through like their own channels of just like of their family members. It's the word of mouth is really huge, particularly around social distancing is important piece. There's a lot of information about COVID and the virus and hygiene, which is great, but an area of focus what the RRC's language access team has been focusing on is really developing culturally relevant messaging that is about the public health policies that are going to be enacting and why they are existing. Because I think that that's really part of like understanding why we are putting these in place, not because we're trying to shun people or like having to punish people, but this is really a community effort that we want people to be a part of and understand why we are doing it. So the next step beyond the PSAs is working with our city departments and developing, again, I think much more simplified pictograph educational materials. For example, the great pictograph flyers that's in the parks about social distancing and 6 feet apart, being able to look at that. But from what we're learning, some communities, 6 feet doesn't translate. So how do we develop something that's going to be translatable? For example, some of the communities have said in their PSAs 2 arms lengths apart. So those are pieces where, as a city, I really appreciate our agency partners because we're learning from them on how to reach people.
Wow, that's a great example, Pitt. Thank you for sharing that. Let's go to our last item and keep you on camera here because you've also been a leader in this. Today, April 1st is Census Day. This is a national day, happens once every 10 years, designed to bring attention to the importance of filling out your census form when the census agency gets in touch with you. We have had for several months an initiative called BTV Count, which also is being led by the Community and Economic Development Office, and Ted has also been a leader in that effort. We knew this was important. The reason we set up a team at CEDO and have convened a number of times key community partners to work with us on the census is census has a huge impact on state, local, and federal policy. It has a huge impact on how federal dollars are distributed. It is essential that we count everyone that we can. If we don't do a good job as a community at counting the people living here, we will actually lose resources for this community from the federal government, and this has long-lasting impacts because you only do this census once every 10 years. There are attempts to update it and amend it in the interim time, but the every 10-year annual count, which is enshrined in our Constitution, plays a big impact for the next 10 years. We're saying it's more important than ever that we count every Burlingtonian because of the time we're living in, because of the COVID-19 emergency. It's very clear that we are looking at an extended period of federal relief and support for communities as a result of the COVID-19 virus and emergency. And if we are not properly counting the various different communities that are part of Burlington, we are going to lose out on that relief effort. And it's going to hold us back in our work to get through this and to recover. Peg, why don't you take it from there and speak to what you've been hearing in your work and what the key messages you think are for everyone to hear and the media to hear on Census Day.
Yeah. Yes, you're exactly right. The census is still relevant today, especially now. We know that people are going through a difficult time. It's uncertain, and there's a lot of changes that's happening. But the census can bring us back together as a community, and this is actually what the census and other like municipalities that are banding together is trying to get the message out. Is that this is really tied to essential services, especially today where a lot of this, like the data that's used on this is going to fund hospitals, first responders, roads, and like emergency service vehicles. So people can help Vermonters today by taking the census and getting the word out, first of all. And as like Burlington, we definitely have been running an active campaign around the census. We've have developed a robust marketing material in multiple languages. We are also developing a PSA in multiple languages and working with the state of Vermont to do a statewide PSA. We have great partners who are pushing this message out, such as the Vermont Committee, the Complete Count Committee. Also, we have UVM with the Rural Center for Rural Studies, and we're reaching out to all the municipalities today to share that this is Census Day, just as a statewide effort to get the word out again. Yeah, we're hopeful, that this will give us a light in a time that is like a difficult, just so that people can rally together and really look at embracing the fact that we can make history today and like during the census so that we can improve our future resources.
I don't want anyone to get the impression that, today's Census Day, and then if you don't fill out the forms or do it right today, you've lost your chance, right? This is going to go on for some time.
It is definitely. It is. This is Census Day, just to like highlight it, but the census will be going on throughout the summertime. This is the first time in history that the census is available online. So you can actually take it online. You can call and take it over the phone. You can take it through mail. You don't even have to have. If you don't want a census worker essentially to come to your house, then there's means for you to take it. They do provide translation services in over 50 languages. So we have a website, BTV Counts website on our city that people can go and learn more about it. And then the survey link is right on there too. But yes, it's fast, it's safe, it's confidential. We're asking everybody in their household to take it, and there is no question about citizenship. So definitely, we encourage people to just take a few minutes and take the census.
Great. I want to make sure that last point was heard and understood. There is no, even though there was speculation previously that there might be a question about citizenship on this year's census, there is not. People should have no concern that somehow by filling out your census form, you're going to in some way jeopardize your any kind of immigration status. It's really important that people understand that that a lot of benefits flow to the community from filling out the forms, and we should all do our part and get that information in. So the last emergency related item I did just want to share is a quick update from, I basically want to pass along the latest update that we have gotten in the mayor's office from Burlington Health and Rehab. It is such a tragedy what we have seen played out in that facility over recent weeks. And again, I share my condolences with those families who have lost loved ones. And I also say again to the family members of the people who are still in the building, the residents that are still there, that our thoughts are with you. And we continue to pay close attention to what is happening there and do everything we can to be supportive of the situation there. An example of that yesterday being, well, I guess just today, another thermometer was dropped off there to help Burlington Health and Rehab regulate the safety of people coming into the building. Here's the latest that we heard from the executive director about this, and there is some there's some mixed news, I would say. The news, I know it's on all of our minds as we've heard about the deaths at the facility, that concerned that the news would get even worse because it was reported previously that there were significant patients in the building, residents in the building that had tested positive. What we now understand is that there are 12 residents in the building that have tested positive. 8 of them have resolved their symptoms or are, the doctors believe, are in the process of resolving their symptoms. And so that is good news about those 8 individuals. Now, of course, there are 4 more that we understand are still in a serious condition, and we're pulling for them as they fight this virus. I did just one additional detail. There's been a lot of question and focus on the different floors in the facility, and that there was the 3rd floor is where rehabilitation patients, not long-term residents, but patients that are just there for some kind of rehabilitation are housed. And we continue to have the word that none of those patients have tested positive, but that there has been success in keeping the virus from infecting patients on that floor. So with that, thank you to everyone for tuning in. I'm happy to take some questions if there are any.
Mayor, we do have, we have a number of questions from, great, take live questions first.
Why don't we take one from the room first, and then we'll go to the phone calls. Go ahead.
So Mayor, what is being done to protect senior living facilities as they kind of seem to be hotspots for the virus?
Well, so I mean, senior communities are hotspots around the world and around the country, in significant part because we know that this virus attacks older individuals very aggressively, and that is, it is people in their 70s and their 80s and their 90s that are most susceptible to this virus. It's always worth reminding people that I think there's some misimpression early on that it was only elderly people that had anything to worry about with respect to health. That has been, I hope everyone has gotten the message that that is not the case. This is, you do not want to get this virus no matter what age you are, but clearly most of the fatalities have been in the elderly population. And that was recognized here in Vermont right away. I mean, Governor Scott's first order put restrictions on visitation and people coming in to these facilities, these senior facilities. There has been a real focus on making sure that the senior homes in this community have sufficient protective equipment. There has been a lot of guidance given to these facilities about what they should do if there is someone who becomes infected within their facility. That guidance has been evolving and updating as the country is coming to terms with this illness. I think it's encouraging to know that, for example, at Quarry Hill, where there was one infection, in the days since that was announced, there have not been additional infections announced there. So I think that's an indication that our healthcare workers, the people working in these facilities, are getting more experience and skilled at how to ensure that there isn't a spread, that they do everything they can to keep this virus from spreading within these facilities when they become aware of it. We were happy to play a small part as a city yesterday. We mentioned, kind of put out the call. We were able to secure this supply of thermometers, which has been in high demand and which can be a tool for regulating the entryways into these facilities that are particularly vulnerable, testing, making sure no one is coming in if they have a fever. We have delivered those thermometers to a number of different senior providers over the course of today. We'll get in days to come. We had 100 of these, and we're keeping track of where they're all going. But the top priority, we put out, as soon as we had these, we put out an email to the senior providers, this group that we knew we would need to be communicating with through this crisis, and we got in touch with them as soon as we had these, and have put that tool in their hands now. there have been additional precautions that have been taking place. Certainly one of the things that I urge the Department of Health and the facility to do once there were infections in Burlington Health and Rehab is make sure that the practice of one healthcare worker working in multiple different facilities that have our elderly there. That is a common practice in the industry. That has stopped, is our understanding at Burlington Health and Rehab since the outbreak began. And I believe in general, there is much less of that happening in the industry right now. So, and I could go on. There's a whole range of precautions that have been taken to in recognition of the fact that these are the most vulnerable members of our community to this virus, and that we need to go take extra steps to isolate them and protect them. We know that hasn't been 100% successful here in Vermont or really anywhere where that's been a broad community transmission of the virus. But I am hopeful. If you've been watching the governor's briefings and what we just heard from Dr. Leffler, the most effective precaution, the one that is going to, there's only so much you can do this enemy that we're fighting here, this virus is microscopic. You can't see it. We don't have enough testing. People can carry it. A large number of people can carry it when they're asymptomatic. This is a very challenging thing to completely seal off our senior facilities if there is broad transmission in the community. And ultimately, there's only so much you can do, and there are viruses that are going to get in if you have broad community transmission, which really takes us back to the discussion that we repeat every day. The most significant thing we can do right now to protect these senior facilities is the responsibility of all of us to do everything we can to flatten the curve, to slow down the transmission of the virus, to make sure there's just less of the virus circulating around in the community and less of a chance of infection getting into one of these sensitive residences.
For sure. And you mentioned something about bringing enforcement actions to try and keep people, socially distancing. Do you want to elaborate on that a little?
I don't want to elaborate today. I'm going to in the next couple of days. The city is looking, first of all, we're looking at what we can do as the weekend approaches to free up some additional public space so it's easier for people to comply with the orders. We know it's getting crowded out there on the bike path. But we also are in communications with the governor's office about we know enforcement matters. Look, we believe in Burlingtonians. We know that I've just, it's something we see in Burlingtonians again and again. Burlingtonians show up, they care, they're engaged, they get it, they're active. And I think you see that happening in this crisis, and just immediately as we started, even before government started taking action, I think Burlingtonians were informed and were starting to pull back from their social activity. We've had a very high rate of compliance. At the same time, we know looking around the world that you can't count on 100% compliance without some form of enforcement. We are looking at, as the chief mentioned the other day, I do expect the next couple of days we will have some announcements about consequences for people that willfully are really being irresponsible and endangering the lives of others through their actions, and there will be penalties that we'll be announcing about that.
Sure, and just a message for Burlingtonians who in this time maybe feeling cooped up and want to get outside and enjoy some of the beautiful views and scenery that we have here.
I think my message here midway through the third week is pretty much the same message I've been saying. But I feel stronger and more confident about each day. What we're doing is working. The social distancing is slowing down the spread of the virus. What the sacrifice people are making is that sacrifice is saving lives. Let's keep it up. The nature of this pandemic is that we have an extended period where we're going to have to continue this. You can get outside. We want people going outside. Exercise is explicitly allowed and supported as part of the governor's order. But it is not normal times when you're outside. You cannot be going up and hugging people in other households. You need to remember the 6-foot rule of thumb, or as we heard from Pitt, 2 arms lengths. We need people to continue to be vigilant and stay strong. That is how we're going to do this. That's how we're going to get through this, keeping as many members of our community as we can healthy. And the better we do this, and this is a little counterintuitive, I don't think everyone has completely gotten this. We know that there is a severe economic impact as a result of these social distancing strategies. Counterintuitively, the better job we do at this, the more we are successful at stopping the spread of the transmission, the more impact on everyday behavior that we have, the quicker we are going to get to the point where we can start to loosen up the economy again and start to reactivate certain businesses and organizations. We will get to that place faster the better job we do today with social distancing.
Thank you.
Great.
All right.
Olivia, there are questions on the list?
Yes, we have a bunch of questions. A reminder for members of the media who are tuning in remotely to email me your questions and I can ask them this way. So let's try to get through a bunch quickly here. First question is from 7 Days and touches on some of what you were just saying. Has the city removed basketball hoops in an effort to stem community spread? And is there any consideration of closing the bike path?
We have not yet removed the basketball hoops. There had been some hope and pleas that we could leave them there so that individuals on their own, that people within certain households could use that resource and do so in a safe way. We are concerned about that. Is one area we have seen consistent concerning activity, and there could well be action to come with that. Was there a second part to that question, not just about the basketball? Oh, closing the bike path. You know, we did get some. We know the bike path's been crowded, and some have suggested that maybe the bike path should be closed. We're at this point not. We don't see it that way. That somehow closing the bike path would make it safer. What we are encouraging already is that for people to be aware that we have more outdoor resources than simply the bike path. If you are feeling unsafe there, if you're feeling it's too crowded there, on the other side of the Beltline, there is an underutilized bike path that goes right along the Intervale. The Intervale itself has trails that are becoming, we're still in spring here, there's still some mud out there, but there's some good walking areas there. Through Ethan Allen Park, there's some good walking areas. We are going to have an announcement before the weekend about additional walking areas that we're going to try to free up to make it easier for people to be outside and to keep social distancing. At this point, we are not considering shutting the bike path down. We don't see that as having a positive impact.
So next question, Joel at the Free Press has a few different questions about masks. Maybe I'll do a set of 2 and then another set of 2. So he's interested in knowing how the specifications for the masks were determined and by whom, and what is their use and for what should they not be used?
So, I'll answer the second part of that question, then turn over to Brian to talk, who's been involved in setting the specifications and making sure we get this right. The use, again, the trajectory of this was the initial discussions and impulse and planning did involve medical professionals out of a concern that we might need to have these masks for that purpose. Since we are increasingly optimistic that that is not going to be needed here in the Burlington area, we are now focusing this effort on essential workers. And we hope to be in position by the early part of next week to announce a program where we could produce by a time certain enough of these masks that every essential worker who wanted one of these masks would get one, and would get one in a timely manner to help them through the weeks ahead as we continue to be under this stay home order, and potentially for quite some time beyond that. None of us know what the world looks like beyond the stay home order. There's a very real possibility that we are only going to come out of this incrementally, that there may need to be an extended posture where there's going to be concern about the virus circulating, and the essential workers will continue to have this protection. That is the focus right now. What I was saying and Brian was mentioning is the broader thinking about masks and whether they could have an important role in keeping more sectors of the public safe is something that has not been recommended by the CDC up until now. But as one of those headlines shows, that is being reconsidered. And we're staying on the front lines of that conversation to understand whether we should be thinking even bigger than simply masking essential workers. For now, what we're focused on is essential workers. That could be expanded in the future. Brian, you want to speak to the specifications?
Sure, absolutely. So the specifications come from the chief medical officer at the Leahy Clinic in Massachusetts. It's not a Leahy Clinic endorsed project, but he is the chief medical officer there. And he shared those with us on a call we helped initiate with UPMC and Dartmouth Hitchcock about a week or two ago. And that's how that project started.
Did you make the point about the testing that is happening there?
Point. No, thank you, Mayor. I think another thing that could be relevant for folks is these materials are being tested at Northeastern University to see about their porosity and permeability. We want to understand exactly how this fabric handles in this kind of situation.
Great.
So we expect those test results back imminently, actually.
Excellent. You had two more. Go ahead.
Yes. Joel is also wondering, how much did the city pay for the fabric? And could you repeat the name of the trauma center in Massachusetts?
Yes, the trauma center that we've been working with is a chief medical officer from the Leahy Clinic, although it is spelled differently than we're used to thinking about Leahy here in Vermont.
They spell it the wrong way. They spell it Lahey. But again, I want to make sure here we're working with the chief medical officer of the Leahy Clinic, not the Leahy Clinic as an institution itself. So I want to make sure I make that distinction here.
And do you want to speak to why the medical officer got involved
Yeah, I think Massachusetts is in a slightly different place than Vermont, and so he and his wife, who is the chief of surgery at Leahy, were looking at how they could best help equip their hospital. These are being used, we're told by them, at a number of hospitals in Massachusetts. They're being used primarily on patients in those hospitals as they come in. I think Emerson Hospital, Lowell General Hospital, and several others that I should check my notes before I say their names.
Great. As far as the cost, the city, we're still tallying some of the invoices, but the approximate cost is approximately $13,000 has been spent on this initiative so far.
One thing that I neglected to say before, Mayor, is it is such a great organic community effort. I think we're spending a lot less than we might otherwise because of people like Gadgews and Rags and Riches and Lyric Theater kind of making these donations and discounts and giving of their time to help us prototype and test these out. And that amount would cover a significant number of masks we could scale up with.
Yes, as you saw with that image of the truck, if this works, there's a lot more material that has been procured and then is being used in these first 120 prototypes. And once you've gotten through this testing stage, we are going to have a plan for scaling up this production and getting as many of these as we need built and fabricated as quickly as we can.
Next question is from 7 Days. Today, the Department of Health noted that its COVID-19 response team had visited Birchwood Terrace Nursing Home. What information do you have about that situation, and is there any indication of a wider outbreak at the facility?
I just got the first call about that from a New North End resident as I was coming over here for the briefing, and so at this point I don't have more public information to share. We will when we have more. I don't have more to share at this briefing, but we we will work to be in position to give a further update when we meet tomorrow.
I think that's all we have. 7 Days also had a question about additional enforcement actions related to social distancing and wanting to know more about what the city is considering. I think you mostly addressed that one already, unless you have any.
I think that's right, Olivia. I don't think I will have more to say about that before the end of the week. We are seeing it being, significant to have additional measures in place before the weekend when we are seeing larger crowds. So stay tuned.
And that's all we have.
All right. I guess the one thing I did, Brian, I think you and I, we should put these on. I've not worn one of these yet. So
you took my temperature yesterday and today you're making me wear a mask.
I don't think so. I was looking at the photos, and so I think this is. Do I have it right, Brian?
I think so.
All right. Sure. So. All right. So these two ties, you can sort of talk while wearing them. Yep. And these go up over the ears.
Beat me, man.
And Hillary, Brian is married to a doctor. I would think your masking skills might be advanced. All right, so there you go. That's what they look like. What I have read, and maybe this is a little, I think we probably shouldn't talk about what but all right, I need to take this off to say a few comments. So, what I've read about these masks, you can immediately, they will take it from some getting used to for people who wear them. You heat up in there quickly, and you need to get used to wearing them, because if you're taking them on and off constantly, it defeats their purpose. Again, the reason we're putting the attention we are to this is increasingly globally seen as a pretty key strategy towards reducing the transmission of the virus. So we'll keep the community posted on this as we get through this piloting stage. And Brian, thank you and your team for all the work on this. Joan, thank you for your leadership and advocacy and making all the relationships work on this effort. And then again, thank you to the Lyric Theater and their volunteers and the Milton Artists Guild. There may be, before we're done with this, additional, well, we already know there are additional community partners. There's Gadgets, there's
Rags and Riches.
And what Rags and Riches, did you explain the role that they've had?
They had a huge role in this in the beginning in helping us get access to this fabric quickly. And they gave us huge discounts in order to get this project going.
Yeah, when we were first talking about it, we were looking at a budget
substantially higher.
Higher. And we will end up spending more if we move into production mode, but this is where we are for now. All right.
Thank you.
I think that's what we got for today, folks. Our plan is to be back here tomorrow at 2. Stay safe, everybody. See you soon.